Dignified social protections for persons with disabilities. What is the conditions of persons with disabilities in Indonesia? The National Team for Accelerated Poverty Reduction, or TNP2K, states that in Indonesia there are 22.22 million people with disabilities, or 9 out of 100 people in Indonesia are persons with disabilities. From the education perspective, based on the BPS study results on people's welfare indicators in 2020, opportunities for persons with disabilities compared to non-disabled people are as follows. For preschool education, it is 60% lower. For the elementary and junior high school education levels, or the 9-year compulsory education program, it is 8.5 times lower. While for senior high schools and vocational senior high school levels, it is 3.3 times lower. As a result, the percentage of non-disabled people who are high school graduates is 29.66%, while the percentage of people with disabilities who are elementary school drops out is 29.35%. In terms of employment opportunities among people with disabilities are 5.4 times lower. The National Employment Survey also confirmed that the labor force participation rate among persons with disabilities fell from 48.2% in 2016 to only 45.9% in 2019. Whereas, among non-disabled people, participation increased from 68.7% to 70%. This condition shows that persons with disabilities in Indonesia are still relatively marginalized. Due to lack of education and employment opportunities, people with disabilities are significantly poorer than non-disabled people. To address this issue, an affirmative social protection system is needed. However, social protection for persons with disabilities is relatively minimal. It is estimated that only 5.5% of persons with disabilities have access to social protection programs. In Indonesia, there is only one program that directly targets persons with disabilities, namely Assistance Programs for Persons with Severe Disabilities, or ASPDB. The government hasn't considered the extra cost of disability a factor to determine the poverty line for families having family members with disabilities. So, only 1.07 million people with disabilities are recorded in the integrated social welfare data. As a result, in poor family-based social assistance programs, such as Family Hope Program, non-cash food relief, National Health Insurance or the Indonesian Health Card or JKNKIS, and Smart Indonesia Program or PIP, the number of persons with disabilities as recipient is relatively low. Meanwhile, in terms of benefits, it is only Family Hope Program that provides an additional benefits of 200,000 rupiah per month for families who have family members with disabilities. Unfortunately, this benefit is only enjoyed by around 102,000 persons with disabilities, or about 1% of the total 10 million Family Hope Program recipients. This situation is contrary to the government's vision to create inclusive development. The government has actively promoted policy changes for persons with disabilities, including ratifications of the Conventions on the Rights of Persons with Disabilities in 2011 through Law No. 19 of 2011, National Regulatory Adjustment through Law No. 8 of 2016 on persons with disabilities, and during 2019 to 2020, the government issued 7 government regulations and 2 presidential regulations. However, some of these regulations are found not to be in line with the interests of persons with disabilities. These policy changes have not been optimally followed by the reform in the social protection system for persons with disabilities and are not followed with adequate budget support. How can persons with disabilities be self-reliant? Persons with disabilities will be able to enjoy inclusivity when the state, the communities, and their families provide adequate support to ensure that every person with disabilities has equal and decent access to employment, public housing, education, infrastructure, public facilities and transportation, as well as health services. In many countries, special social protection schemes for persons with disabilities have been established. In Singapore, services for persons with disabilities can be accessed in an integrated manner through Singapore Enable. In Australia, there is National Disability Insurance Services or NDIS. In Hong Kong and the United States, there are disability services. All of them can provide access to information, services, and registration either online through the website or a call center that can be contacted via telephone, as well as available disability services offices, plus a supporting community that helps persons with disabilities access information and services. Thus, all benefits of the programs for persons with disabilities can be well distributed to potential beneficiaries, and an easy access is facilitated. The programs offered by those countries may vary, but almost all of them cover various comprehensive aspects, ranging from access to employment, housing, education, health, concessions, cash transfer, assistive devices, and transportation. In Indonesia, a Dignified social protection program for all persons with disabilities needs to be designed and introduced. This program consists of 3 sub-programs, namely Concession Program, Cash Transfer Program, and Direct Service Program for persons with disabilities. Concession Program. Concessions with fee exemptions or discounts for electricity rates, phone bills, internet, public transportations, house rent, clean water, land and building tax, motor vehicle tax, and others. Cash Transfer Program. The benefits of Cash Transfer Program can be distributed to 7 targets. Cash Transfer, direct disability benefit valid for life, distributed to all persons with disabilities to cover their additional living costs due to their disability condition or extra cost of disability. Care support and education fee support benefits, distributed to children with disabilities because children with disabilities have additional needs to accommodate their disabilities, including for transportation to school, therapy, medicines, stationaries, and so on. Unemployment benefit, distributed to adults with disabilities who are not yet working. Income benefits for adults with disability who work with low levels of income or income below the amount equivalent to the district or city minimum wage. Benefits for working disabled women. Universal retirement benefit for the elderly with disabilities. Caregiver benefits is provided as an incentive to caregivers to take care of the people with severe disabilities or to reduce the burden on the family. Direct Service Program, BPJS Kesehatan or the National Health Insurance Program, and BPJS Ketenagakerjaan or National Employment Insurance Program, consulting, therapy, training services, fulfillment of assistive devices according to the medical needs and recommendation, mobility services, including subsidized motorbike modifications, pick-up and drop-off services to access health and school facilities, affirmative programs, housing access, priority to occupy subsidized and accessible public housing, because it has been very difficult for people with disabilities to get access to occupy public housing such as Rusunawa or subsidized rental unit houses rented with priority to people with low incomes. Access to entrepreneurship support programs such as KUR or microcredit program, KUBE or joint business groups, and others. Personal assistance support. Impact of investment on persons with disabilities for the economy. The National Team for Accelerated Poverty Reduction or TNP2K stated that the support of social protection programs for the elderly and persons with disabilities, which amounts to 200 to 400,000 rupiah per month, would be able to reduce the national poverty rate to 1 up until 1.3%. The World Bank in 2020 provides a more optimistic estimate, stating that if the coverage of the benefits provided reaches 70% of the populations of the elderly and persons with disabilities, the poverty rate will at least decrease by 32% from the existing condition, namely 9.7% to around 6.6% only. Social protection programs for persons with disabilities will also have an impact on families and communities. In a study conducted by AT-Scale using the return of investment or ROI model, it is estimated that an investment of $1 billion through social and health program benefits, especially for the provisions of assistive devices, will be able to produce a productive economic impact during the period of use of the devices, namely amounting to $8,500 billion and provide benefits to families amounting to $1,900 billion. So, over the next 55 years, it is predicted to produce a multiplier effect of $10 trillion. This study confirms that assistive devices is a relatively profitable investment both on the micro and macro scales. Through social protection programs for persons with disabilities, the government is promoting an inclusive economic growth while reducing household burdens for families having family members with disabilities and making them much more productive. In the future, persons with disabilities will no longer need to be seen as a burden to development. Instead, they will become active contributors to the national economy. Persons with disabilities are not burdens. They are a potential resource as long as the state is present to support them and their families and communities support them towards the realizations of an inclusive society. Persons with disabilities can do it. Let's work together.